was Napoleon? What did Napoleon die of? Anybody know?
Pneumonia.
What's that? Is he the one with a ruptured gastric ulcer? Either that or cirrhosis. One of those two things. So anyway, we have this link between health and disease, and we already know what the link is, right? What's the link? Why are some people healthy and some people not, if we have these same triggers?
Terrain.
Close. It's the terrain, not just the temperament. It's truly the terrain. You expose 100 people to the same thing, some will get sick, some won't, because of their terrain. And of course, I think last year we did a presentation on terrain. So it's the balance of miasm, temperament, and constitution, which people sort of talk about, people don't know much about. I mean, we talk about temperament because Hippocrates talked about it, and then in 100 AD, the real doctor, who should really be the father of medicine. So what's his name? Anyway, he talked about it too. And then Paracelsus talked about it. And then of course Shakespeare wrote about it. Because pretty much every character in Shakespeare's plays is each of the actors, each of the characters had a different temperament. And he spells it out. If you read Borky from homeopathic, they'll tell you the temperament. Some remedies are better suited to certain temperaments. So it was well talked about and more talked about in those days than it ever is now. Yes, constitution, of course, the way of miasm that Hahnemann initially talked about. So of course we need to help people stay on this healthy journey for what's going on. And they need to be able to understand the physiology and biochemistry without having to go to Jeff Bland's course and figure out what the hell this P450 system is, or what the Krebs cycle is all about, all the intermediates. And it's like, who the hell cares? Now, well, let's just do SNP because nobody has any enzymes anymore, so no wonder you have problems because you have all these SNP problems. So we do all this genetic testing thinking that that's going to be, and I think genetic testing is actually a detriment. It's a great thing, but it's a detriment to people because now they say, oh, the reason I have this is because I don't have the genes. Now I don't have to do anything because I can't change it. It's like, I'm too bad. I mean, woe is me. So I was like, I just have to live with this. So you fix me. So in one way, it's, for the patients who will go by it, but more and more, so what the patients are now waiting for is that when will the gene transplants happen? When will we be able to take this little snip, take it out, and stick in a new hard drive? Type things. Then I'm sure somebody's going to try and work on that because, oh, this will be a multi-million way of doing things. So of course, then we have these three words we saw in the paper today. This whole idea of detox. Even the 90%ers are starting to read about detox. They may not know what it is, but it's something that they need to do, they think. So they think about detox as Lindsay Lohan going to rehab 5 times. Or Justin Bieber in rehab now because he's a jerk. So that's what they think detox is really about for what's going on. It's like, it's a little bit more than that. So we're not detoxing from drugs or alcohol. We're actually trying to facilitate the body's ability to heal itself, which is different from depuration, which is different from drainage. So detox, as you already know, is a P450 system. I'm not going to go over that stuff. Depuration. I think one of the things about depuration that you heard about for a long time, also Dr. Pinion here, probably the best known ND in this country anyway, who basically has promoted this whole style of getting rid of xenobiotics, which are these compounds that the body really, what the hell are these compounds anyway? Now, one of the challenges with doing therapies that are depuration is that it exceeds physiological limits, which is like you're going beyond the body's ability to recover unless you know what you're doing and it can pull it back. It's like blowing up a balloon and you go one puff of air too many and it blows up. So it's trying to find that really close balance where you don't create so much self-destruction the body can't come back. So I used to do that procedure. I think there's great things to be done for that, and I think there's some patients who require it. But for me personally, the reason that I've chosen to go drainage route is because it doesn't exceed physiological limits. It takes the cell, takes the extracellular matrix, takes the intracellular matrix to that level that you don't force apoptosis, that you don't literally destroy the physiology of what's going on, but you push it just enough to be pushing it in the right direction. So, you know, we have this idea that physiologically it facilitates the body's removal of toxin, whatever the body perceives that to be. So, you know, as per definition, this was written by Maury, who was a French homeopath in the 50s. You know, it's basically this process. So the big thing about toxicity is that, you know, we talk about it all the time, but one of the problems is, why does the body have toxins? And the reason the body has toxins is because it doesn't recognize it as a toxin. So it doesn't recognize that it's a toxin. And if you don't recognize it, the body's not going to do anything with it. So one of the first things that needs to happen is you need to wake up the patient's immune system. So that if this is something that's not good, the body should be reacting against this thing. Otherwise, it just lives that, and that's one of the issues, I'm convinced, with Lyme disease. Because we've turned off the immune system by this myriad of antibiotic therapies, especially long-term. You know, doxycycline for 2 weeks at an acute probably works just fine. When you're into somebody who's had this for 10 years, I don't think antibiotics are going to cure this person. In fact, I know it's not going to, because it's really going after the wrong thing. Because the immune system has been so suppressed for so long, you're going to have to totally go in a different, you're going to have to look at this in a different approach. Come at this in a different way. So if we finally are able to recognize it, we then have to figure out how the body's going to neutralize it. We don't want this, especially acid toxins, to be circulating through the body. So once you neutralize it, then it needs to be removed. One of the things about what, in my experience, that Unda numbers can do is they're able to do all three of those things in a dose that's physiologic. It first of all wakes up your own body to say, if something isn't good here, then it'll allow the body to activate its own systems to neutralize it, and then it will support the homunculus to get rid of it, which is kind of exactly what we're attempting to do, whether we're removing a heavy metal or an emotional toxin or plastic or pesticides or whatever you want to do. And yes, colonics and a variety of nutraceuticals can be extremely helpful, but we can also do it without making the patient really sick. People often talk about healing crisis. You know, what's a healing crisis? You need a healing crisis to truly get better. And you know, in the first years I practiced, I thought I did. I thought that was a sign that that's how the body could react. But you know, since I started using these remedies 15 or 18 years ago, it's like, I don't see that anymore. But what I realized what I was doing, I was just pushing the person past their physiological limit and making them feel terrible. And I didn't have to make them feel terrible. Because I don't believe you need a healing crisis to get better. What I do believe is you need to wake up their physiology so that the body can react. So the most important thing that I like to see is not that they, you know, people always talk, especially with Lyme, they have Herxheimer reactions. It's like, why do we have Herxheimer reactions? Because your homunculus don't work properly. Oh, the dose was too strong or that. Well, the dose may have been too strong, but why are you giving them a high dose if their homunculus don't work properly? Which is why you never chelate somebody who's constipated. Because, man, you want to make them worse? You just find an homunculus that's blocked and start chelating, and you'll say, and they'll say, oh, you're just having, you know, this side effect, or don't worry, we see that all the time. Come back tomorrow and we'll stick some other vitamin back in you and you'll feel better. It's like, well, instead of sticking something in, maybe we need to get rid of something for what's going on. So we have this, you know, we have detoxification, depuration, and then of course we have drainage itself. So, you know, what are we draining? We're draining the 5 homunculus. And, you know, however you do that, whatever therapy you use to do that, there's a lot of natural therapies, there's a lot of natural laws that we can follow to make that happen, which is really in your best interest. You know, that model is the same type thing. And, you know, drainage is not just about detoxification. As we've just said, you know, we have these, and the thing that we also forget is that most serious toxin is not external to us. Is internal to us. It's our own self-generation of our own toxins, called CO2, that we don't get out of our body, that becomes stuck in tissues. We impregnate our tissues with unfortunately, unhealthy foods. Unhealthy foods that get stuck in fat tissue because they can't be metabolized properly. And we start looking at how we use it collectively, how our patients, us, intoxicate ourselves. And we wonder why we get sick. And then the patients come to us and we spend years in medical school learning all these disease things, now coming up with some miracle thing to try and make them feel better. And yet we still don't harbor on, well, why are you breaking natural laws every day? Like, how can we really treat a patient as a naturopath and not spend time talking about what they're supposed to eat? Now, whether they eat it or not is another thing. But in reality, at least I think we're obliged to do that, per se. Some of you may have heard years ago, you may have heard me tell this story. There was a naturopath in Portland, probably 15 years ago, who, at that time, I don't know, there were probably 75 or 80 naturopaths in Portland. So he surveyed every one of them, and he simply asked, how many of you use diet as one of your primary therapies? These are, and I would say 95% of them are probably NCM grads. So how many of them do you think said they use diet, this was 15 years ago, as their primary therapy? What percentage? 100, should be 100, right? How could it not be 100? Well, it was 29%. 29% of NDs use diet as a primary therapy. So he said, well, what the hell do you use? Well, people don't want to change their diet, so I just found it was a waste of time. Well, what do you do? Well, I just give them supplements. That's really not a good solution. Yeah, it's nice that they'll keep buying a supplement, but it's really, I think we have a better solution, is we keep trying to train and educate so our patients understand the process for what's going on. I've already said that. So, the reason we need to sleep 7.5 hours is so we can get physical, physiologic, and mental rest. It really is important. There's a reason we need to sleep. There's a reason we need to get into REM sleep. There's a reason we need to process through the day. Because you process. Remember, your brain remembers everything. Everything you've ever experienced is all in there. And one of the healing aspects is bringing it to the surface so that they can process it again, which is very scary for a lot of people. You can create a lot of nightmares and anxiety and panic attacks, and so you have to be prepared for that to happen, because that's what's going to happen. It has to happen. It's the only way you can get rid of them. You can't just keep suppressing them and hope they never come to the surface. They have to come to the surface when you're dealing with this stuff. And the patient can be freaking out, and as long as you can, manage it, hopefully the patient can live with it also. So we have this cleansing thing. Talked about that earlier today. So that's why I do this with all patients. These are natural laws. Every one of those is a natural law. They don't violate natural laws, they just work with natural laws. Breathing, water, movement, hydro, sleep, being outside. Is apple cider vinegar a natural law? Well, it's better than taking an enzyme. It is a way to stimulate digestive function. It is a way to upregulate digestive function. And of course, whatever diet you're going to do. Do we need to take EFAs as a supplement? No, we just need to eat them. So we need to buy seeds. And there's lots of great seeds, nuts, avocados, coconut. Now, coconut water, we heard it today. It's the most popular thing there is on the market. Next year it'll be something else. People, it was in the cancer thing last weekend. There's a reason that probiotics need to be ingested daily. Not like every once a week. Because 60% of your flora is dead, of your stool is dead flora. And flora itself is its own organ. It's not about, SIBO and all this other stuff. It's about it's an organ. Your system, your flora is its own organ because it has many functions as an organ does. And it's no wonder people have so many problems because this organ called flora doesn't work. And it works very poorly. And why? Because we've intoxicated it with all kinds of things. Have fun. Basal body temperature, some basic stuff. We have the 3 levels of disease, the lesional aspects that students love to celebrate because, oh my God, you should have heard that person's lung. They couldn't breathe. It was full of fluid. It was so wonderful. I heard a patient with pneumonia. How terrible. Why don't you rather listen to every lung that's healthy, and when you hear that pneumonia lung, you say, oh God, you got pneumonia. You got a serious problem. Instead of worrying about the fact you've never heard somebody with pneumonia. If you listen to enough normals, you won't have any problem identifying an abnormal. And so don't worry about the fact that you haven't seen pathology and you've missed it out. Don't worry. When you see it, it will stand out like a sore thumb. And it does, and you say, oh God, I wish I didn't hear this. Because now we've got something really serious to deal with. And you do. So then we, of course, go to functional problems and then energetic type problems. So one of the reasons that Unda numbers are not considered, as kosher by large segments of our population called physicians, because we like to throw stones at each other, I guess, for one, for whatever reason that is. First of all, Unda numbers were formulated the late 1800s, the early 1900s, by 3 doctors who over the course of 20 years mixed and matched a bunch of remedies. And they mixed and matched them using these theories. Of course, at the time, Rudolf Steiner was going around and making all these lectures about weird stuff that nobody understood, about anthroposophical medicine, which if you really can't sleep, start reading one of his books. You'll read a page and you'll be sound asleep because it is so dense, it is so complicated. It's like I've multiple times tried to read it. You read one paragraph 4 times and say, what the hell did that just say? I have no idea what I just read. And I'm relatively intelligent. I think I knew the English language well, and I still can't understand what it says. Anyway, he was prominent at the time. The miasmatic theory, of course, had become prominent because Hahnemann had talked about it that had been talked about for 50 years. Oligotherapy had been promoted by other homeopaths as being small elements that could stimulate enzymes. Chinese medicine, of course, had been around herbally for 3,000 years. And then homeopathy had been around for 100 plus years. So you combine several schools of thought, and what these 3 gentlemen did is that they then combined plants and metals together based on all those different theories. Remember in the 1800s they tried to do alchemy, try to make gold out of other elements. So they were manipulating real elements. So the metal that's in the Unda number is a pure metal. It's not a salt, it's the actual metal. And of course plant medicine and herbology has been studied from the Chinese for over 3,000 years. And then you have the carrier, which is alcohol. Now the one thing you can't do with an Unda number, if you still want the Unda number, is heat it. You can't, just like I'm sure your herbalist have told you, if you have a tincture, somebody sends it with alcohol, basically just heat it up and you'll evaporate the alcohol. Well, if you evaporate the alcohol in the Unda number, you don't have anything left. Because the plant and the metal energy is impregnated into the alcohol. It's really, the alcohol is part of the remedy. So you get rid of it, you don't have any remedy anymore. So if somebody says, under no circumstance can I take alcohol, then you can't use Unda numbers. Which isn't true, but it's because it's psychological. Because people, especially people in AA, so the people in AA and people on transplant lists are told to avoid alcohol at all costs because it'll do this and that. So having said that, I can tell you that I treat dozens and dozens of people who go to AA every day with Unda numbers. And it doesn't make them become an alcoholic because it's not the alcohol that makes them an alcoholic. What you can treat with Unda numbers is the reason they're alcoholic. And it's like, hey, take all the alcohol you want. And they don't go back to drinking the alcohol, mind you. But it's not the alcohol that sets it off. It's the underlying physiologic imbalance. Their systems are out of balance that sets them off. And that's really what the difference is. So from my practice anyway, if people, if they're only adamant, I'll say, okay, we won't use them. My experience is I've used them very successfully in many other patients who are alcoholics or on the liver transplant list or whatever. But if your doctor, you personally don't believe it, then don't do it. So the thing with the plants in this particular case is, as you know, plants are organotrophic. So when you study different herbal medicines, what you already know is that the plants have a predilection for specific tissues. So these remedies were formulated with the idea that the plant would go to a specific tissue. And as they would do that, they would drag the metal along with it. And so theoretically, it's the combination of the plant metal and alcohol that's impregnated in it, because the alcohol is a carrier that gets it there. That's how it gets from your oral cavity to your liver or your nervous system or your stomach or your big toe or wherever it's going, your right ovary, etc. So the Unda number itself, so Unda number 2, you read the label. The label says it contains Petrosolinum, Rhamnus francula, Thalapsy, Juniper, Asparagus, Berberis, Genista, and Argenta. And people say, well, that sure looks like a combination remedy to me. Like, you got all these different energies in there. How can this not be a combination remedy? The reason it's not a combination remedy is because this particular mix is a single energetic compound. And if you do Kirlian photography of it, if you do spectrophotometry, which is what Unda developed, and you can, you know, I've been there several times, totally fascinated by their technology. You basically can see that a remedy made 5 years ago is the same as a remedy made today, which will be the same as a remedy made 5 years from now, because it actually has an energetic imprint. And if they use different herbs, it's not the same imprint and it's not the same remedy. So people, and because one of the things that is trade secret is how did they combine these? And it's like you can't just stick this one with this one with this one. These are actually impregnated into each other. And it's done in a very specific order to get the specific energetic blueprint that you're looking for. So this is a single remedy that has a single energetic imprint, no different than belladonna or pulsatilla or chocolate is. And is chocolate a single remedy? What's in chocolate? Is it just cocoa? Is it cocoa and milk? Is there sugar in it? Is that now a combination remedy? Or is it real? What is it? So, you know, so it's maybe semantics. So, and if you're not comfortable with that being a single remedy, then don't use it as a single remedy. People say it's not homeopathy. Okay, it's not homeopathy. It's like, call it energy medicine then. Like, call it whatever you want. The name is like, who cares what the name is? Does it work? I think it should be more relevant to, will it help our patients? Will it help them solve the problem? Will it provide a solution to what it is that we're looking for? And of course, it will. At least that's my experience. And then there's different metals that are in these things. You know, once again, for those of you coming, I'll go over them more in detail at the seminar in March. And each of the metals have specific purposes. And really, what are Unda numbers doing? I mean, I think this summarizes them the best. I said it already, you have to optimize among trees. No matter what you're doing, what therapy you're using, whether you use Unda numbers or some other therapeutic, that's what you need to do. You should really think of, is the therapy I'm using have any impact on the person's among trees? We know what the among trees are. You know, we know what we're supposed to do with them. And it's like, or do we even think about among trees? Do we even care about the among trees when we're giving product X, Y, or Z? Do you ever think about it? You know, and if you're not doing a remedy to do that, then is the person following a natural law that will facilitate their among trees? One way or the other, if you don't do number one, you're going to not get the therapeutic effect that you really would get like from that particular therapy, whatever it is you're using. I mean, that's as simple as that. If you can optimize the among trees, you can then move free toxicity, which is basically facilitated within the numbers anyway. It's to get it out, to get it in to this extracellular space. Where does it go then? How the hell does it get out of the body anyway? If it goes from the intracellular to the extracellular, how does it now leave the body? What happens next? Lymph. Oh, that sounds like a natural law. Why do we have to move? Because what moves your limb? Movement. That's the #1 lymphatic treatment. That's why movement is essential for health. You can't have somebody who's stationary, possibly, that's unfortunately why, I mean, they learned a long time ago. You know, my dad had a heart attack in the 50s. You know, in those days, he just said, stay in bed for a month. But that's not the therapy anymore. Like, get up 10 minutes after you've had it. Move. It's no longer lie in bed. Oh, rest your heart. It's like, you know, that's not a good, that wasn't, but that's what they thought in those days. So it's not like that anymore for what's going on. So optimizing the endocrine system, detoxifying organs, and then, of course, ultimately changing the terrain. We have these 5 stages, which is called the cellular state, which is an intracellular component of that. We have every single cell is a hepatocyte. No, it's not true. Every single cell acts like a hepatocyte. And what does the hepatocyte do? What is the function of hepatocyte? What does the hepatocyte do in our body? Detox. Sorry, I didn't hear you.
Yeah, no.
Sorry. Right, it detoxifies, so you know the role of the liver is good or it's not good. It's as simple as that. I keep it or get rid of the damn stuff. And if you want to get rid of it, the hepatocyte is trying to make it less toxic, but sometimes it makes it more toxic. Every single cell wants to get rid of the toxins. And the most common toxin in every cell is CO2, because every cell is respiring, taking in oxygen and nutrients and giving off waste products called CO2. That has to get out and out of the body. So every time you see a chem screen and the CO2 is over 25, the person's holding onto their CO2. And they're also anxious. You'll find that most anxious people have the highest CO2. Why? Because it's poisoning their brain, and they don't realize it. They're poisoning their brain with their own CO2. So guess what the #1 treatment is? Breathe and oxygen. Stick them on oxygen. Oh, amazing how that works. So we have renal and the pulmonary aspect. We have secondary metabolism. We have the emunctory stages, etc. So once again, it's more about details. Just a note about dosing. When a person has an acute problem with Unda numbers, and I have to say, this is the easiest thing to treat. It's acute problems, and I so often am asked by people, how do you treat acute and whatever? If you know Unda numbers, you will never ask that question again, because it is so easy. That is, if you learn nothing else from Unda numbers, just use them to treat acute. Because it will take you all of 10 seconds to come up with the formula. They're very straightforward. It's really easy to do because it's always just natural laws. So anyway, we won't do it tonight, but there are specific Unda numbers for pretty much any acute condition, and the dosing is 6 times a day. That's really the key thing about acute. You take them often. In fact, if I'm taking something for acute, usually it's 4 remedies, as opposed to 3, which is the most common. Just line all 4 up. Every hour I take one. Just always taking something, all through the day, per se. And acutes, I have dozens of these so-called miracles, 1-dose cures. And you'll see that, but you won't see it in somebody who's clogged the emunctory. Because people always say, you told me that if I gave this patient number 27 and 44 for their urinary tract infection, it would clear up. Oh, I did that and it didn't clear up. I said, well, then why do you think it didn't clear up? I don't know, you told me it would clear up. So I can guarantee you acutes work much better on patients who have clean emunctories. If you have clogged emunctories, you're going to take it a lot longer than just 3 or 4 doses. And it's not going to clear up right away. So there's a reality to that, but acute Unda prescribing is easy and effective, especially if you can. That's why you tell them drink water and fast, and do a colonic or do an enema, get the colon cleaned out, do deep breathing, do a mustard plaster, do hydrotherapy, do all that stuff, and then go and eat some chicken soup because your grandmother told you was the best treatment you could do. Perfect. Children, it's 3 drops. A kid is anybody under 4. If you're 4 and up, it's now an adult. So it's not like childhood until teens. For the sake of Unda numbers, we use 4 as the cutoff. After 4, it's adult dosing. But for kids, it's 3 drops a couple times a day. If it's a baby, you can put it on the 2 elbow creases and the belly button. So just put a few drops, 1 remedy here, 1 remedy here, 1 remedy in the belly button for a baby. If it's something like I've treated several babies with pneumonia, and we tried that, but it got worse, I said you got to give them orally. I mean, you learn from your mistakes. So if it's relatively serious, I don't even tell them to put them on the skin. You got to give them orally. So we'll put all 3 remedies in like a dropper full of water, and just squirt them in the baby's mouth. That works pretty well. Works actually very well. We're doing that. But if we're treating eczema or colic, or but that's not serious, but you can do, assuming, of course, they haven't slathered something on. The reason it works on a baby is because their skin is still soft. They haven't put soaps and lotions and everything else that we lather on, sunscreens and everything else and stuff on it.
How many days before the baby started turning the corner with the symptoms when you did the
Within 1 day. Within 1 day of doing it orally. They got worse doing it topically, which is 1 day. I said we're going orally, we're going 6 times a day in an eyedropper. By the end of the day and that night, the baby started sleeping better and just the usual number of days to clear the pneumonia. But many people would not even dare to read it. But it's just, I mean, that's about trust. Here's a mom, there's a baby who was, I probably was 8, 9 months old, going to a naturopath, because of course you know what the treatment is. It's not supposed to be. It's like her parents freaked out. Why are you not giving your baby antibiotics? Because that's the only treatment. Well, because I don't believe in antibiotics. So you can say, I'm never going to do that, and don't do that. For you, if that's not your level of comfort. Don't treat a patient that you're not comfortable with, no matter what the treatment is. If you're not comfortable, you send them to somebody else, because you're not going to have success. I'm pretty comfortable with treating anything. Because thankfully, I've had a lot of experience, and I know what to expect. You won't have seen it. If you see an 8-month-old baby, I doubt you'll be wanting to use Unda numbers. I kind of just doubt it. But when you've given as many prescriptions as I have, I think I'm okay with it. But you really have to follow them. You know, it's like pneumonia and glomerulonephritis, all kinds of stuff. And people say, oh, you can't treat it. Yeah, you can treat it. It says I can't treat it. Of course I can treat it. It's just about the body and physiology. I mean, there's nothing special about it. It's not like these are magic. These are not magical. They're just remedies. And then the most common is the chronic conditions of 5 drops 3 times a day. And people say, well, it's 15 drops a day. And one of the reasons it's 15 drops a day is because of the size of the bottle. And the size of the bottle is that if you take all the drops in there at 15 drops a day, that remedy will last 21 to 22 days. And it's one of the best ways to know if the person's taken the remedy. Because when they come back in 4 weeks and say, are you finished the remedies? Oh no, I gotta have a bottle left, but it's not working. There's probably a reason it's not working, because you're not taking it. Oh yeah, I'm taking it every day. Well then, that bottle should have been empty a week ago. So 5 drops 3 times a day. And why 3 times a day as opposed to 8 drops? Or 8 and 7? It's because it just works better. If you come to the seminar, I'll tell you the story of why I do that. And in cancer, we do it 4 times a day, which are some serious degenerative conditions. There are 76 numbers, numbered from number 1 to 1002.
Do the numbers expire?
No, but there's an expiry on the label.
But it's still good after that?
It's good forever.
Potency doesn't come down though?
It's good forever.
Okay.
Assuming you don't stick it out in your back porch when it's 115, or you don't put it in the refrigerator and freeze the damn stuff in the freezer. And why do you want to know why there's an expiration date on it? Because there is.
Yeah.
Why is there an expiration date on it?
Just the law.
Because in Europe, where these are made, it's a pharmaceutical. This is not a remedy. This is a pharmaceutical remedy. And it's made in a pharmaceutical facility that has the ability to make drugs, because they have the same standards. Whether they make a homeopathic, a nutraceutical, or pharmaceutical, it's the same standards in Europe. So they have to put an expiration date on it. But I can tell you, they've looked at remedies that they made in 1955, and it looks exactly the same. It was made in 2000, and, well, whenever I was there, 2008 or something. It's no different. And it would still work, but they, of course, they can't sell it because of law. That's the only reason. So there's 76 remedies, and why is it numbered from number 1 to number 1002? It's because when these 3 docs, in their 20 years of research, they made 1,002 formulas. But they then, in 1936, when they published the material in Paris, they said the pharmacists started complaining because they had so many herbs, because they literally would write the formula out, just like you would write a prescription out. The patient would take it to the pharmacist, and the pharmacist would make the remedy on the spot. So they had this, you know, shelves and shelves and shelves of metals and plants, and they said, we can't keep making all these remedies. So they said, okay, let's narrow it down. We'll take the 70, and they ended up with 76 of the most commonly prescribed, most effective remedies. So that's why some of the numbers are left out. Number 1 to 50 is consecutive, and then the next remedy is number 74, and then it's 76, and there's a whole bunch missing in between. So we'll explain that. There's 4 different groups, and I'm not going to go over them because in the whole detail of that. So it's mix and match. The reality is that this thing, you know, for the I'm sure if you come to the seminar, they'll give you this wonderful thing made by this perfect, really nice guy. But basically, it's all on these different levels. And basically, what you do is you pick one remedy from the top row, you pick one remedy from the functional row, and one remedy from the drainage row, based on which organ system you're treating. And it's based on organ systems, not symptoms, which is the big thing with other numbers. And so it's called mixing and matching. Since there's 76 remedies, and you do 3 remedies, you have about 450,000 possibilities of remedies, which is why you can treat anything. There isn't anything you can't treat within the numbers, because you have so many different options to choose from. But you don't have to learn 450,000 remedies, you only need to learn 76 remedies. And if you learn them well in the organ systems that they fall into, you'll basically get an understanding of you know, what's going on. So I'm not going to go over the rest of this because I want to show you a case that I saw yesterday that I thought was really fascinating. So is there any questions or comments about Unda numbers? And if you really want to learn them, come to the seminar because you'll hear them ad nauseum, and I'll try and teach you how to use these things. They're really not pretty effective, they're highly effective.
When you're speaking about like metabolism and toxins, is CO2 the only like natural toxin that's just inherent in our metabolism?
No, there's uric acid, and there's lots of other ones that have to get out of the body too. It's just one that's the most common because we're respiring 17,000 times a day. So the body says, "Oh, we better get rid of this one. Otherwise, why would we have to breathe so often?" You know, if it was not that much, since CO2 is what we're breathing out. So if we're breathing 17 times, you know, how many? Imagine if you had 17,000 bowel movements a day, or had to pee 17,000 times. Like, oh, we're getting rid of a lot of toxicity. So it's like we breathe a lot for a reason, because every cell is making this stuff. Any other questions?